The nominated clinical practice guideline that was critiqued in our appraisal was the New Zealand Autism Spectrum Disorder Guideline. This was critiqued using the Agree-To tool, which is a valid and reliable tool that is used to evaluate the process of practice guideline development and the quality of reporting. The tool is comprised of 23 items, which are divided into 6 domains. An overall assessment of the quality of the guideline is included at the conclusion of the appraisal. Today we will be summarising our main findings based on the Agree-To tool.
Domain 1. Domain 1 evaluates the scope and purpose of the guideline and is generally concerned with the overall aim, the specific health questions, and the target population. Our findings revealed that, overall, the objectives of the guideline were well described. The health intent of the guideline was clearly stated as to provide best evidence for the identification, diagnosis and assessment of children and adults with ASD, as well as intervention and service pathways. A thorough description of expected benefits was presented, and the target population was well defined as children, young people and adults with ASD in New Zealand. The clinical condition was also explained in reasonable detail, with acknowledgement of the severity and variation in the condition. The Agree-To tool also alerted us to some gaps that existed in Domain 1. We found that the health questions were not sufficiently addressed or explicitly stated, while the target populations, settings, outcomes and interventions were generally described within the paragraphs of the chapters. Locating this information was exhaustive and spread across different locations. Finally, while the guideline was primarily tailored to the New Zealand population, this would potentially be a limiting factor for other populations, as there is a large emphasis on the Maori people.
Domain 2. The purpose of Domain 2 is to analyse stakeholder involvement. This focuses on the extent to which the guideline is representative of its intended users and the stakeholders' contribution to the developmental process. Domain 2 demonstrated strengths in several areas. A description of the intended users and the different purposes of the guideline was clearly stated. It also defined and described the members involved in the developmental process in appropriate detail, with the individual names, expertise, and geographical locations of the relevant members clearly listed. The guideline also presented comprehensive input from a range of stakeholders, including a steering group made up of members of the community, indicating a broad network of information. There were areas of Domain 2 that were limiting, particularly in regards to the methodology section. For the 3 different work streams, methodologies were described in varying detail. For 2 of the 3 work streams, there was a heavy focus on evidence-based practice. However, information on how this information was sourced was noticeably absent. There was a distinct lack of information provided. Furthermore, while most of the stakeholder descriptions were of high quality, there was no individual role description provided beyond the title for members of the guideline.
Domain 3. Domain 3 appraises the rigour of development. This specifically relates to the process used to gather and synthesise the evidence, and the methods used to formulate and update the recommendations. Overall, this domain was rated fairly poorly and received the second lowest score rating by our group members across all of the domains. In terms of the systematic methods, the quality was relatively poor, as methodology reporting was either incomplete or was referred to via a faulty link or an inaccessible report, thus limiting the access of procedures undertaken. The criteria for selecting evidence also varied across the 3 work streams, providing a fairly limited summary of evidence. Information was located under the heading Methodology. However, comprehensive information such as expected outcomes, exclusion criteria, or time periods were not provided. There was mention of the target population and the study design, however this was not in enough detail to replicate the search. The CPG's description of the strengths and limitations was also reviewed. While the CPG provided a clear description of the NZGG grading system, the evidence tables again were inaccessible via a faulty link, so analysis of the evidence and consistency of the grading was also not possible. The CPG did not explicitly state how the development group considered health benefits, side effects, and risks when formulating the recommendations. An impact analysis, albeit brief, was completed to assess the likely impact of implemented key recommendations from the guideline. The link between the recommendations and the supporting evidence was also inconsistent across the guideline. The guideline was externally reviewed by experts prior to publication, improving the quality of the evidence. While this domain as a whole did not rate highly, there were some items that were of improved quality. For example, the guideline clearly described some elements of the external review process. External reviewers were thoroughly listed, including health, education, disability, and social service sectors. Methods included a mail-out, revision of the document by 9 international experts in ASD, and modifications of the guidelines based on these findings. There was, however, no description of the method by which these reviewers provided feedback. A brief description of the recommendation development process was also provided, with reference to quality, applicability, and consistency of evidence. In cases where no evidence was available, information was based on personal experiences within the team and consultation within New Zealand, although there was no discussion of exactly how this process influenced the recommendations. The health benefits, side effects, and risks were reported to have been considered in formulating the recommendations. And finally, in terms of reporting procedures for updating the guideline, a living guideline approach was developed and described. This appeared to be an adequate method of review. While revision of the CPG was stated to occur at defined intervals, these were not specifically defined, nor was there a criteria stated for inclusion of new evidence. It was encouraging to note, however, that an updated document was said to be printed in 5 years' time. A working link was also provided to access additional procedures used to update the ASD guideline.
Domain 4. Domain 4 assesses the guideline's clarity of presentation, addressing the language, structure, and format of the guideline. We found that in the CPG, the key recommendations were easily identifiable, with reference to their location on the contents page. They were also easy to locate as they were visually presented in a table format with clear headings and simple formatting. These recommendations reflected the key messages of the guideline to provide best practice information for health professionals, educators, and consumers working and living with people with ASD. Relevant populations were consistently addressed. The intent was easily identifiable in the recommendations with high-level evidence. However, less information was provided for recommendations with lower levels of evidence. Limiting features of Domain 4 included the unclear description of options within the guideline, and the one pathway offered for the majority of recommendations. Options were not specifically discussed beyond discussion of management in terms of variability to the individual, which resulted in vague explanations.
Domain 5. Domain 5 addresses the likely barriers and facilitators associated with implementation, uptake, and resource implications of applying the guideline. Descriptions of barriers and facilitators were consistently provided throughout the guideline. Methods used to determine these included objective and prospective analysis. The impact analysis was a particular strength of the developmental process that was developed specifically so that the impact of the recommendations could be identified. While the barriers were well described, they were difficult to locate in the document as they were spread over multiple sections and headings were not used to aid identification. Furthermore, there was very little information on how the recommendations could actually be applied, with only general statements relating to supports and incentives. Checklists and rating scales were referred to in the broadest sense, with no identification of particularly useful tools and no validation procedures identified. There was limited consideration given to resource implications of the guideline, such as funding sources and cost analysis. Additionally, another limiting factor of the guideline was the lack of criteria for auditing the implementations of recommendations.
Domain 6. Domain 6 covers the editorial independence, which is concerned with the formulation of recommendations and preventing bias associated with competing interests. The Ministries of Health and Education funded the development of the guideline. This information was easily found within the document. There was, however, no explicit statement that the funding body did not influence the content or that the development group had addressed this potential influence. Competing stakeholders were considered, as indicated by the Declaration of Competing Interests, and no competing interests were declared. This being said, there was no information about what constituted a competing interest. There were no measures to minimise their influence, and there was no information regarding any follow-up to check for authenticity of responses.
To summarise the critique, an overall assessment was conducted to rate the overall quality of the guideline and to ascertain whether the guideline would be recommended for use in practice. As a group, we found that the guideline provided clear and comprehensive information relating to the diagnosis and management of people with ASD from a holistic perspective. While most of the information in the guideline was of high quality, information relating to the rigour of development was difficult to access due to faulty links and insufficient referencing of documents. The format of the guideline was noticeably lengthy, however the use of colour, headings and tables assisted the retrieval of information. Generally, this guideline was of a reasonably high standard and we would recommend its use with some modifications.